Welcome to another episode of Chief Healthcare Officer podcast show, which is the healthcare leadership podcast show, helping us to delve into the healthcare issues globally, and then we discuss all the subjects together with the field experts. Today, I have my guest. She's an architect and coming from a pharmacy family, and her name is Fiona Sartoretto Verna. And she is a global expert, visiting all the countries and meeting with the hospitals and then the pharmacies to improve the operations. So here, I just want to start the discussion with asking her background first. Fiona, thanks for joining us today.
It's a big pleasure also for me to be here today and talk with all your followers that are thousands and thousands. So like me, you are a traveler. So we know what I mean.
I really appreciate. So you're teaching us what the pharmacy operation should be, and then how things could work better in a patient-centric way, and how we can have better value from the pharmacy operations. We will discuss all those things. But before that, could you please just share your background with the listeners? And I want them to know you better, not just from the LinkedIn profile, but just give us some further background about yourself.
Sure. First of all, I'm the third generation of a family that is devoted to pharmacies. Pharmacy is a very big niche, so it's small but it's big. My family started with my grandfather that was born in US, and then he started with my father to design pharmacy in the 1965. That is the year of foundation of our company, that in fact have my last name, Sartoretto Verna. That is a complicated last name, a double last name. But I'm the third generation together with my brother. My brother is the CEO of the company, is responsible for the Italian market. I am the traveler, like we said before. So the one that all the time travel all over the world. So this means that I saw from, I think 20 years or more, because I want to tell you that when I was little, our office was in our home. So my father designed the table in a corner of the house, all the time pharmacy. So I have all this pharmacy coming from all parts of Italy in Christmas time, in holidays time, in the night, because of course the pharmacy in the normal time are open. And so I always say, what are these pharmacies? What it means? Now when I grew up, I degree in architecture like my brother, and we start to do survey and follow all the survey all over the world of our father works, and start a little bit to contact us from US, from a different part of Europe. The first time from Saudi Arabia was Mr. Malek Al-Musa that contacted us. So one step by one step, we start to do pharmacy also in other countries. And from there, I start to travel and meet a lot of people. So my expertise is based on this, to the direct look of different markets in different countries, always in pharmacies. So we design pharmacy independent, so that they belongs to independent owners, hospital pharmacy of private or governmental hospital, or chain, pharmacy chain that can be small group or big, large group. From each of these, we learn something different and try to keep always what is the best from one part to the others. So my company, what does in practical way? We design and optimize the pharmacy, and also we realize with the fixture that my father and other people design specially for the pharmacy, for the pharmacist.
Amazing. I mean, when I look at the pharmacy operations, especially like me, the hospital operators, I mean, we always have been operating our pharmacies. And then what happens? We just spare a corner in our ground floor of the hospitals. And then we expect one of the pharmacists actually to be the pharmacy expert. And we expect this person or the people to manage the pharmacy. But then within the limited individual experience or the capacity, for them, it is about dispensing business. I mean, people come to the pharmacy counter, then they look at the doctor's prescription, and then they check the prescription if it is correct or not. And thanks to all our great pharmacists, they correct us as the physicians. Sometimes we may give the wrong dosages and the other thing. Then they correct that. Or they look at the availability, they offer the equivalent, the generic, and then the other things. So that is only what we came to know. And then we were expecting our people to offer that. Then later on, we came to understand that actually in medicine, whatever you do, you're working to identify the diagnosis. You're studying all the symptoms, diagnostics, and everything. And at the end, you reach to the prescription. And all these efforts is actually to create the right prescription for our patient. And when we give this prescription to someone else, we expect our pharmacist to offer this prescription in the best way. And we expect our patient to adhere these prescriptions details, and we can get the best outcome from the treatment. But then actually pharmacy becomes the most critical area for our operation. If pharmacy doesn't work, none of those efforts will give the outcome, will support the outcome. So then we came to know that, okay, now we need to look at the patient-centered pharmacy model, and then we need to go for it. So here, I want to ask you, what does a patient-friendly pharmacy look like from a physical and process perspective? Or let's say I'm designing my hospital's pharmacy today. What makes it different from the specific design principles or the trends shaping these current modern pharmacies? So let's start from the patient-centered pharmacy design, then we can discuss the further operational things together.
Sure, Ala, what you say is practically all true because almost all the pharmacy I visit, they don't give so much importance to the pharmacy. On the contrary, I notice that is very important for first of all for the position because usually it's true the pharmacy is maybe the second thing that your patient see when they come inside the hospital. They see the lobby with the reception, and then there is the pharmacy over there. So, and from outside, if you are lucky, you have an outpatient pharmacy, it's also very visible from outside the window of the pharmacy in the ground floor. But for me, it's totally the opposite because I see the pharmacy hospital overall outpatient like a big opportunity for hospital to advertise themselves, to invite other patients inside the hospital, inside the pharmacy to advertise the hospital service itself. You ask me about the patient experience. So, first of all, in the hospital pharmacy I visit, this experience has been not so positive because the first thing, the flow of the pathway inside the hospital pharmacy depend from the different patients that come inside the hospital pharmacy. So there are the ones that are insured, the ones that are don't, the ones that come inside only to ask information, or maybe if there is some retails, they want to buy something quick to bring to their family or patient that are in the hospital. So when you need to consider all this pathway, all these people, and how to serve them in the quickest way possible. And of course, to give a adequate communication to them. So first of all, the patient come inside the pharmacy from the lobby or from an outside door. So we have a pharmacy that is different from the street pharmacy or normal pharmacy because you have to access and exit. These change a lot the flow inside and also the optimization of the space.
I totally agree. I mean, when we look at the insurance patients, you need a waiting area because always the insurance approval takes time. And you need to consider such things. For the cash patients, they can simply approach to the counter, give their prescription, and then buy it, and then hear the pharmacy counseling, and then they can leave it. So I think in many, especially the hospital pharmacies, this kind of patient experience and flow have not been considered. And that's why we are not able to offer the best experience over there for now.
Yes, usually they are very bored. They are sometimes in comfortable couch, but sometimes in chair, and it depends the country where we are. But you know very well in Saudi Arabia, for example, you need to consider a lot what happened, and so that maybe all the couch, the people don't sit one next to the other, but maybe two people, then there is a empty space because they don't like to stay so crowded together. But this is what happen all the time. See people like we say in a post office in Italy, sit or in a movie theater. In truth, I want and I think that the patient experience need to be different. First of all, because inside there are patients that are already sick. So they are not at their best. So we want that they feel better, they feel good. So to create an atmosphere around this waiting area that inspires serenity and with colors, with the materials, create a certain of peace inside their heart and mind, no? Someone have a headache, so let's consider the patient experience from the patient experience, not a designer or not a manager that is in the hospital. Because if I go and I'm sick, I don't want music. I don't want like a street pharmacy. I want something relaxing. But instead, I want also to be entertained. And because my mind, maybe if it's entertained, don't concentrate in the pain, no? And from years, we consider always the pharmacy a place of sickness. Well, I consider the pharmacy a place of wellness, a place of prevention, a place where a right advice, and like you said before, the right prescription, the right therapy help me, help my life, help my mood, help my family. So for me, pharmacy is a place where it's positive to go, not where it's sick,
I
and so
totally agree.
everything.
I totally agree. And we need to create these pharmacies as the extension of all the other medical services rather than an odd part of all this system. So it should be clearly designed as part of all the process and then regular flow. But here, I have one interesting question, and I need to ask this to you. I need your guidance on that one. When I look at the operations of the pharmacies 10, 15 years ago, I mean, in London or in even Milano or, in Istanbul or the other places, pharmacies, they were only pharmacy before. And there were some accessories, medical accessories sold a bit here and there. Something has happened. We have started seeing a front office, and this front office started putting some cosmetic items, daily needs, especially for the women. I mean, they love, now I see many, pharmacies, people, they don't want to leave. They still want to walk around the shelves. They want to check the items, vitamins or the daily needs. It became something like a supermarket. So how do you see this change? And I started seeing this concept not just in the retail pharmacies on the street. And I have started this change also within the pharmacies in the hospitals, the one that we were telling in the ground floor. I just visited a newly opened hospital, I think 2 months ago, and their ground floor was something like a supermarket, huge. And but not just because of the medical pharmacy side, it was mainly because of the front office side. They were calling it as front office. So what do you think about this change?
Allora, as I told you, I follow the evolution in different countries and in the history of the pharmacy. So it really depends in which country we are seeing the evolution of the pharmacy. But what you see is true. Before the pharmacy was all, I'm laughing because I'm telling you something that in the way last week I was in New York. So I'm telling you something that now it reproposes itself, because before in the history, the pharmacy was the one with the dark wood, huge counter, and the pharmacist was behind with a severe, and not customer care or smiling like most of the pharmacy good are today. I'm laughing because in New York now the chain are all locked down. So I just wrote this morning an article on this, and I visit some Walgreens in New York City, and there is no one shelf that is not under glass with a button that you push and you need to call the customer service. The evolution has been this, of course. So the pharmacy, the problem in most of the country is that when the pharmacy was powerful, he owned the price of the medicine. But when the government in different countries take off this for help, for sometimes not for help in America, but so they take off the profits, the revenue that before was based on the medicine from the pharmacist. The pharmacists start to look the front end, so the part in front of the counter, because when I design, for me the counter is the Maginot boundaries. So everything is in front is what make you money. What is on the back is what
Doesn't make
you
money.
spend money, no?
Yeah, very
So
very small margins. I know. I mean, it's, in many countries, I think this is the new trend now. Government sets the price, sets the margin, and that's why the only way to make money out of the pharmacy operations are FOCs. I mean, if you charge items that you receive at the end of the year, or some volume based, some other things, because this is the only way you can somehow create some margin. You're right. So then this has pushed the people to create some further things at the front of the counter.
yes, so they start to imagine how they can make other profits. And this was a little bit wrong, because in this way, the pharmacies start to sell everything. Let's put apart US that have a history, the cowboy that arrive to the store that have everything, also the medicine in the real, history. But in Italy itself, when the Italian government put the ticket on the medicine, the pharmacy start to use the front end. And this use transform the front end in supermarket, like you say. Like in Saudi Arabia, when I came 10 years ago, all the pharmacy, and still a lot are like this, are supermarket, really supermarket. You can find everything, no? But what happened? COVID. The COVID created a line on this first, because the COVID show again to customer that the pharmacist is not only a retail owner, it's a medical supporter, it's a health professionalist that was open during this emergency. And this give the strength through the vaccination and all the service to open up again a different perspective for the pharmacies. Something that my company always think. So we were not following the current of the commercial pharmacy, but we always continue to talk about the pharmacy in a professional way. So the pharmacy of the service. And for me, what is missing, like you said before, is exactly true. Also in the hospital pharmacy outpatient is this connection between the service that you offer like a hospital and the service you can offer in a quick way, like a clinic, like a walk-in, inside the pharmacy. But you are already inside a hospital. So
It
what
should be part
happens?
of the regular operation. Then this should be just considered as a natural extent. But I will tell you one thing. When I look at my pharmacy operations, I mean, we were having many challenges, but then one of the challenges I could consider as the main challenge is the mindset, because we always put one of our pharmacists as the leader of the pharmacy operation. But unfortunately, these pharmacists in their school, they did not receive any lecture, any lesson how to operate a pharmacy. They have been trained how to be a pharmacist, but then how to operate a pharmacy was my challenge. And I'm asking them, hey guys, we need to focus on the process optimization. We need to decrease the waiting times. I need more efficient operation. But at the same time, you have to make the patients happy and also do not increase the manpower a lot. So then we need to, I'm sure my pharmacist friends are laughing me now. I mean, I always have tried to keep the manpower at a good level, if I may say, from my point of view. So how do you think, I mean, we can balance these challenges and at the same time the patient experience? And when you go and meet with the pharmacy owners and also the hospital owners, how do you explain this? Because you're the advocate of this, I mean, process management and then experience management.
It's very hard, but I tell you, also architect, when they come out from the degree, they know only to design, and they need to start to think like a business. And the same is what I explain to my client. I always explain the example like a temple. So like I tell you before, the pharmacy before where the revenue came from the medicine. But now the same pharmacist need to do several action to create profits. The same is in the hospital pharmacy. So the pharmacist manager need to act like a business. So this is why it's so important in the optimization of the space to consider the retail. But my opinion, if we consider the front end, we need to consider retail and category of product related to the hospital. So not like a chain, not like a retail pharmacy, but like a hospital pharmacy. In this, I really, with the help of the artificial intelligence, study the sickness that this generation have, all the generation that are alive and the one that will come. So my daughter that is 13, what will be the problem she will have? And based on this, we create a category that you can use in hospital pharmacy that can help to have more revenue. From the part of the pharmacist is not easy because, as you say, they are concentrated in what is medicine, what is their advice. But they need to understand that also the way in what they speak with the patient create the feeling, the atmosphere, the relaxation, no? So I always say, make a smile, welcoming your patient, because it's very important. But what happens all the time? The pharmacist is not smiling because it's not comfortable. Is not happy, is nervous. He need to do thousands of things. So for me, when I design, I consider the patient experience, but I consider also the employee experience, the pharmacist and the employee, because it's very important. It's the match of the two that create a successful environment where both work. It's a win-to-win, like every work. No, the pharmacist have to explain something difficult because maybe the patient is a chronic one disease or is worry or whatever. It's not easy. So the atmosphere create this sense of relaxation. The pharmacy is happy because is in a comfortable chair. He know that he's protected by his team. His team also is happy. So for me, it's a domino effect that we need
Very
to
true,
create.
very true. I always say this. I mean, if your caregiver is not happy, your patients will never be happy. I mean, you have to put the smile on the face of your doctors, nurses, pharmacists. Then, I mean, your patient will be happy. But to make them happier, I mean, when I visited, one small place in UK, and I have seen over there in a rural area something like an ATM machine, pharmacy machine, and then NHS is now trying to do such things. And I have seen some of the brands, I don't need to mention the brands here, they are offering some of the outpatient pharmacy robots to make our pharmacists happier. So then they don't need to run back to the shelves and then look for the items. And in China, I have seen very interesting machines now. I mean, they are from the unit dose. It is not just about creating the boxes. The machine creates for each dosage small plastic bags, so then you don't need to know at which time how many boxes you need to open and then take them one by one. For morning dosage, it has all the tablets inside, and for the noon, for evening, for night, everything are very well designed, which makes the life of pharmacists easier. And I'm seeing the applications now, some of the websites. I think the pharmacy technology is also evolving, and I'm seeing many innovations. So, what do you think about these robots? Are they really making the life easy or making things more complex?
Absolutely, I'm a pro technology, I'm a pro automation. Every new technology that arrive, we test, we introduce in the pharmacy, we partner with the company that does this news. I'm also pro artificial intelligence. I use it. From now 1 year, we already did the master and classes for pharmacists because they don't know so much about it, how to we create a prompt for them. But coming back to the robot, absolutely, one of the things that make the patient irritation, grumpiness, and all of us doesn't like to wait. I went inside the pharmacy, hospital pharmacy, where the waiting time was 40 minutes, 45 minutes. It's a waste of time for both, no? And as I told you, if the pharmacist have in front a patient that is irritated, is grumpy, is shouting, this is not good. Automation can help all this because reduce the time, but not only reduce the time of delivery, give time to the pharmacist to talk more with the patient, to give more advice, to go in deep the therapy. And this is important. Also, the back of the pharmacy, we still have not talked about this. It's very important it's like a machine. The motor need to be organized very well. The automation help absolutely to do this because you can put the robot on a different floor if you don't have a space. Sometimes we also in the design put outside the pharmacy if it was not possible in the same building. So the automation is a big resource. I just arrived from Expo Farm in Lisbon because last week I was in New York and after in Portugal. And I was with all the team of Goldman, for example. And so we talk about this a lot, how can help the robot inside the normal routine, the normal work of the pharmacist. there are many different kind of technology, starting from software that can help to keep in track. Now, for example, there are all the Wi-Fi label, so you have not to lose time to replace or think when some product is expire. Some for security also. So technology is something very, very important. We now introduce in our pharmacy some music that you can listen from outside the pharmacy through the windows, or all the kind I'm sure you see in Korea, because they are mastering this, of film, pellicola, that you can put in the glass, so when there is a big sun rays, it cover automatically became more opaque or transparent if it's a consultation room. Or you can project some video, and so you can inform. Because another part that is very important, and it's part of the revolution inside the pharmacy, the communication. So how you communicate things that a pharmacist want, not like a paper attached, like the one they give me right now, attached to the prescription counter, but something that is digital, no? Also the system of control the lines. So the
Amazing.
when
I
it's
think it is all about improving the experience inside. And here, what I see, we have lots of things to learn from the other industries. Sometimes when we look at the healthcare, we always isolate ourselves. If you look at the other industries, retail industries, definitely we can learn lots of things to elevate the experience of our clients, of our patients, of our visitors, guests, and then the other things. I really appreciate. And I mean, recently in one of the hospitals, actually, I procured something called Carousel. I mean, it is a huge device managing the inventories and everything. And watching the device itself when it works is something really I enjoy. So I appreciate, I mean, being a pro techno person, and we want to hear and learn more from you. And I also recommend to all our listeners to follow Fiona's LinkedIn page. You will enjoy following her, and then you will learn more, and you will see all these technology things, how you can improve the pharmacy operation. So, Fiona, I think we are about to close and coming to the end. There are many pharmacy managers listening this podcast show. So, what would you advise them? What would you recommend them to improve their spaces and at the same time the process and making their patients happier?
Allora, first of all, just to go inside, if they already have a pharmacy that is working, go inside and look with a different eye. So try to put yourself in the clothes of a patient, and then in the clothes of your employee. So it's very important to do this. Most of the time, when I do this pharmacy safari, I really take off the idea I'm an architect and try to be only me. Me that go inside a health store, because this is a pharmacy, this is not a retail, and look with these eyes what are the issues that you can solve immediately. Like most of the time, there are always the same problem, the wrong lights, no? Because also this is, for me, in a hospital pharmacy, I'm a person that suffer of big, strong light, really hit me. So it's one of the first thing I see if it's completely dark, because sometimes they think pharmacy are pub. So you don't see anything. Or they think, like some in Saudi Arabia, that is a disco light. So
Yes, I have
it's
seen
very
that.
tremendous.
Yeah, I
So
mean,
this,
we have to hold our horses sometimes to design our
yeah,
things in the right way. I totally agree with you. I mean, I have seen such pharmacies too.
yeah, so for me, this is very important. Like every retail in the world, the light is what make the difference. So just starting from this, a good lighting study can really switch from one side to the other the perception of your patient and employee inside your pharmacy. Then, the truth is that if we talk about hospital pharmacy, not so many they introduce the retail side, no, because they still procurement officer are not agree to waste money. But in truth, for my experience, we open also now a hospital in Canada, in Toronto, for the Michael Garon Hospital. In truth, it's a revenue side that hospital director or owner need to consider. Another things, the category. Cioè, it's don't sell stupid product inside a hospital. You can have a gift corner, of course, for the patient. But let's do a study of this, no? Insomnia is something that now almost all the people suffer. I don't see category of sleeping problem inside hospital pharmacy. I don't see this kind of a big issue they have the kids right now solve in the hospital pharmacy. So another thing manager can do is analyze very well their category and try to change in the way that is connect with the service that the hospital. If the hospital is for mom or babies, of course, let's analyze what are the needs that the community have to find the solution inside the hospital pharmacy.
I totally agree. I mean, I think we need to look at the patient flow. We need to know our patient, and we need to design all these needs based on what patients' expectations are. Then we need to understand if in case I have a hospital which has high, numbers of pediatric patients, then we need to design it accordingly. Maybe my hospital has high number of chronic patients, then we need to design it accordingly. And also, I really love the point about the employee experience. In many pharmacies, I think this is something missed. I see some counters without any chairs and a thing. I mean, those people in the entire daily shift, they are asked to stand over there and at the same time to serve this overwhelming job while managing the services, counseling the patients, getting the right medication, and managing insurance also. This is some other thing that's added to their work, which was not the part of that before. So I really, enjoyed our discussion, Fiona. Thank you so much. If for
There
the
is so
closing
much
marks,
to say, because it's a word. So really, we can go deeper and deeper and deeper.
I totally agree. I totally agree with you. So thanks for your time. Thanks for joining me in this discussion. I'm sure listeners will enjoy hearing all these insights, and then we will see much better pharmacy operations all over the world in the hospitals and retail pharmacies again. Thank you so much,
Thank you
Fiona.
very much. Thanks. Thanks to you, and I hope this can help. And for everything, just drop me a line and I'm here.
Thank you so much. My listeners, as you can see, we will continue covering many subjects from the healthcare operations. And it's my pleasure introducing my network to you and great people from my network. And please, let's look at our patients' needs and experience, and let's try to offer a better experience every day. Thank you so much for listening, and tune in for coming more episodes.